Coming up, we'll be on location at the Shakthi Health and Wellness Center and Pain and Spine Specialists of Maryland in Mount Airy, Maryland, discussing the latest advances in pain treatment and management and how they can help relieve the debilitating pain that so many people experience with one of this region's top pain management specialists, Dr. Sudhir Rao. Dr. Rao received his medical degree from St. George's University and completed his residency at Montefiore Medical Center. He has also completed his fellowship at the prestigious Mount Sinai Hospital in New York. Dr. Rao is a member of the prestigious North American Neuromodulation Society, among other organizations, and is widely recognized as one of this region's top docs. Welcome, Dr. Rao. It's a pleasure having you on our program.
Thank you, Rocco. Happy to be here.
Well, it's your first time, in fact, on the Top Doctors Medical Interviews. We've got a lot to talk about. We have a patient that's going to be joining us a bit later, but I wanted to begin, if I may, Doctor, by asking you if you can please tell us what some of the latest advances are in pain treatment and management.
Well, the latest advances are spinal cord stimulation, platelet-rich plasma therapy, as well as stem cell therapy.
Very interesting. Can you begin by telling us about spinal cord stimulation and how it can benefit us?
Sure. Spinal cord stimulation has grown over the last 30 years or so, and it's a technique that can help people with chronic nerve pain that hasn't responded to surgery, medications, physical therapy, or even injections. It's like a pacemaker for the spine, and what it does is it blocks pain signals in people's back, legs, neck, or arms, and replaces it with the tingling sensation.
So what takes place next then?
So once we identify the right patient, then we can do a trial or a test where we place these little wires into the spine under x-ray guidance, and we hook it up to a generator and a remote control. And once we get adequate tingling around the painful areas, we're able to send the patient home. There's no incisions, there's no sutures, it's just tape that keeps these wires in place for about 3 to 5 days. They come back, we take the tape off, the wires come out, and we ask patients how much better did they feel. So they get to tell us how much better this therapy is helping them, as opposed to most other things where we tell patients that it's most likely going to help you 50%, 70%. In this case, the patient tells us how much it helped, and if it's worthwhile and it seems like it's helped enough, then we go ahead and put the permanent device in place.
And who would you say, Dr. Rao, would be a good candidate that can benefit from spinal cord stimulation?
So any type of patient who has ongoing burning, throbbing, shooting pain, and they may have failed surgery, they may have failed injection therapy, they may have been on medications that are no longer helping them or causing side effects. They may have ongoing neuropathy from diabetes or other conditions.
Okay, and how would you diagnose a particular patient to see if they would be a good candidate for spinal cord?
So like most cases or most conditions, the diagnosis is mainly from what the patient describes their pain is from. We do a physical examination, we do some imaging such as MRI or x-rays. We put all this together and see what's the best next step for them.
And what kind of results are the patients seeing from the therapy?
So for the right type of patients, and I stress that, for the patients who are appropriate for this type of therapy, we're getting 85 to 90% improvement in these types of people.
That is a significant success rate.
Absolutely, especially over the last 5 years. The technology has significantly changed and improved, so we're really able to help a lot of people who have otherwise thought to be helpless.
Now, as far as PRP, which is the platelets-rich plasma treatments, therapy, and also the stem cell therapy, can you tell us about those two? Because we hear a lot about both right now.
Absolutely. PRP, or platelet-rich plasma, as well as stem cell therapy, are truly cutting-edge therapies that medicine's able to provide to patients. And there are two different types of therapies, but both regenerative medicine. So we're looking at regenerating the human body either through blood products or stem cell itself. And we are getting to a point where we're able to regenerate tendons, muscles, ligaments, discs that have otherwise not been able to be treated short of surgery or chronic medication management.
Very interesting, and obviously in the case of both of these therapies, you hear about pro athletes, for example, who RG3 here in Washington, not to mention Adrian Peterson, who was an incredible candidate, how fast he came back and set the NFL rushing record, or came close to it, in literally less than a year from having this therapy, the stem cell therapy. How how is it working on such levels? I know those are extreme recovery cases. That isn't the norm necessarily, but nevertheless, the research is really indicating rapid recovery, coming back as strong, if not even stronger in some cases, prior to injury. I mean, how is all this happening?
It works on basic physiology in our body. We use growth factors to heal, and growth factors are factors that our body makes or that are stored or are available through stem cells. So whether we're spinning down someone's blood and using platelet-rich plasma to regenerate and provide growth factors to an injured area, or we're taking and introducing stem cells themselves into that injured area, the premise is we're trying to regenerate tissue, regenerate cells for people to recover faster. This is, like you mentioned, this is a great option for athletes who have muscle strains, sprains, tears, disc disease that has disc herniations. These are ways that people can potentially avoid surgery, get a speedy recovery, and get back to the level they want to function. But that being said, it's not just for elite athletes, it's for everyone. Anyone who has either mild to moderate disease states or problems, maybe a candidate for PRP, golfers, tennis players with knees or shoulders and elbow injuries. You have ongoing patients who have ongoing back pain may benefit from stem cell therapy into the disc itself. So we've got the elite athletes that do very well. We have also the general lay public that could benefit from this as well. The problem is that most people don't know about it or they don't understand a lot about it.
Yes.
And that's why we're trying to become a center of excellence in this area to really hone these skills and provide these services.
Yes, indeed. And what I love about this is that these are very natural therapies. You're not putting anything into your system that isn't natural, right, so to speak.
Right.
And that's an important distinction.
Right, and that's part of our wellness center. So our wellness center is based on trying to get people healthier, getting them better using all natural techniques. So in PRP, we're using your own blood. In stem cell, we're using embryonic or placental stem cells, which are day one of life. So it's the most natural and the first types of cells that are available.
And what kind of results can we expect from these treatments and therapies?
Once again, based on the right choice of patients for the right types of therapies, we're seeing 80% improvement in some patients. People who thought their only other option was surgery, who didn't either want to have surgery or had too many risks, other health risks to undergo surgery, or didn't have the time to recover from surgery. Those are the types of people that do extremely well. So we're looking at an 80% plus improvement in either functionality or pain relief.
And again, another significant success rate number, just like with spinal cord stimulation.
Absolutely.
We're now going to meet Randall, who's a patient of Dr. Rao, and he had a stem cell therapy treatment. Welcome, Randall. It's nice having you on our program.
Thank you.
Now, I wanted to begin by asking you what problem or problems were you going through that brought you here to Shakthi Health and Wellness Center?
You know, I had been suffering for a while, probably multiple years. I had seen Dr. Rao at his previous practice. It all stemmed from me doing some tries. I got into CrossFit. Now, I'm not here to blame CrossFit, but I think I did some activities that put some strain on my back. Long story short, I had two herniated discs at the L4, L5, L5S1. They were causing me tremendous problems. My tri activity had stopped. Basically, quality of life had pretty much, just completely stopped. Yeah. I was focusing just, normal routine to get to work and to get home in the evening. And then it was everything I could do to kind of, to try to get myself back into some working form. If you've ever had lower back issues, your hips mine at least did, would sometimes get out of place. Just tremendous spasms, tremendous just pain, a few hours sleep each night. So long story short, I had great recovery with the epidural steroid injections. I did those. I think I did 2 series of those, and they were very, very helpful. The problem is that when you recover, my downtime I probably should have waited a little bit longer to get back into a running, CrossFit mentality. So I would go through waves, and I would after the wave, I would seem to fall off after a period of time. So the steroid epidural injections really worked well, but after about 2.5 years, I had basically kind of just completely fallen off a cliff, and I could not recover from anything I was doing.
My goodness, you were going through quite a bit there.
Yeah, it was
affecting your life in every which way, and so
absolutely.
Then that's where you were prior to coming to Dr. Rao and
Yes.
Shakthi Health and Wellness.
Correct.
So what happened once you got here, Rand?
So I was a finance guy prior to my position now, and I'm very familiar with stem cell regenerative medicine, and we had an opportunity to potentially think outside the box, look at a brand new alternative that a lot of people on the East Coast aren't even familiar with. I had a tremendous time trying to find a doctor. Sudhir was willing to try these trials, and basically what we did is we did something called mesenchymal stem cell, which is regenerative medicine, and we did an injection into my L4, L5, L5S1. And it was pretty crazy. It was, I had a lot of variables that we really didn't know much about, but the after effect has been tremendous.
Because we're hearing more and more in society as far as stem cells
Yes,
and
sir.
how they're
Yes,
benefiting so many people. Just a couple of celebrity athletes
Yes.
who we all know and heard about recently. Adrian Peterson, his knee recovery was at a record pace, and obviously he had stem cells implanted by Dr. Andrews.
Yes.
RG3 here
Correct.
locally with the Redskins, same thing. Just as a couple of examples. So you had it done as well, injected right into your lower back, as you just said, into 2 discs. And what happened after that?
Well, I had a tear. I should say I had a tear in my back as well. So it's a very simple procedure, believe it or not. I probably wasn't on the table that long. The procedure went very well. There was some downtime of about a week and a half to 2 weeks where I needed to take the medication for recovery. But after that time frame, I was able to immediately start physical therapy. And I started from day one, re-strengthening my core. I had probably, I had not done as much as I needed to heading into that, so it was a lot of recovery for me. But everything's back in place. I feel great. I'm very cognizant what I do now. I do have a trainer, which I had never had before, and he's actually helping me, like I say, with my back and, trying to get back into a routine where I can lose a little bit more, and focus.
Well, at least you have your life back,
Yes,
your quality
absolutely.
of life. You can sleep at night. You can work during the day. You can enjoy life, which you weren't able to do for a few years when those epidurals weren't really doing the job, because as you mentioned earlier, they were just temporary relief, then you fall back into that very painful situation prior to coming here. And since you've had the stem cell treatments and you're back to normal, you're feeling great, we're very happy to hear that for you.
I couldn't be happier. So it's amazing where I was and where I am now are night and day.
Now, as far as the viewers out there watching, what would you tell them about your experience not only with Dr. Rao and the results that you've already told us about, but also the staff here at Shakthi Health and Wellness Center?
Their team, so to speak, trained me and, showed me different options that I had. The stem cell route was one option. There were other options that I had, potentially surgery, but the spine with surgery, things like that, I really didn't want to go that route. But yeah, I would just say that, with Dr. Rao, with his medical assistants and with the team, it's just been a home run. I mean, I couldn't say anything more. I mean, just the smile that I have and the fact that I can swing a golf club and I can go for a run just brighten my day. So.
Well, on that note, Randall, we'd like to thank you for coming down, joining us, being a guest, and telling us about your experience, your results, and we're so happy for you.
Thank you so much.
Thanks for joining us.
You're welcome.
We're now back with Dr. Rao. I must say, Randall, very powerful results have taken place with him with the stem cell therapy treatment.
Yes, he did very well. Actually, better than I even expected. He was very close to going under the knife and needing surgery, and now he's back to exercising, swimming, and doing the things that he loves to do.
And you know, surgery should always be the last resort. We all know that. Unfortunately, it's not always the case for folks, but for them to now know that there are therapies, treatments with these type of success rates that are non-invasive, non-surgical, oriented, that get the results that we're talking about, it's very powerful, Dr. Rao.
Absolutely. If people need surgery, surgery is a good option. But if there are ways to avoid surgery or give people other conservative options, that's what we're all about.
Now, I wanted to ask you before I let you go, Dr. Rao, you and your practice, Shakthi Health and Wellness Center and Pain and Spine Specialists of Maryland here in Mount Airy, Maryland, have certainly established a reputation for excellence in patient care, pain management. You're cutting edge. I mean, you're really at the forefront in this entire region in how you're helping so many folks get their lives back. I wanted to just ask you, what would you say helps separate you all from many of the other practices in this region?
What really separates us from other practices is that we provide a level of customer service that's different than any other practice. We provide a place for patients to come that's comforting, relaxing, yet still uses the state-of-the-art technology and the latest advances in medicine to get people better.
Yes, indeed. The patients love you all. They love not just you and your sister here who are doing great work, but the whole staff from what we've heard.
Well, thank you.
Well, on that note, I want to thank you, Dr. Rao, for joining us, being a guest on our program. We'd love to have you back on in the future.
Thank you very much, Rocco.
Thank you.